The chronic disease co-care model is a co-payment scheme. The initial design is thinking about that. The citizens have their own responsibility to take care of their own health. So that's why we want to have a co-payment system so that they actually are taking the responsibility of taking good care of themselves. But we understand that there are some citizens in the society is actually financially less privileged. And then we are thinking in the process in this co-care model, the chronic disease screening and assessment and then treatment model could be adopted in hospital authority. And the hospital authority has a robust mechanism to waiving all the fees for those underprivileged group. So we are now in the process of talking to the hospital authority, fixing the details, and hopefully we'll have the program implemented for the underprivileged group sooner. This diabetic senile hypertension screening program, or say co-care model, is a pilot scheme. So it's a 3-year pilot scheme. Mainly because this is a program, we need to build a lot of infrastructure to enhance the primary healthcare system. So when the infrastructure is built, basically we can apply to other diseases. And we intended to do a holistic care rather than breaking patients or breaking citizens into different organs or different diseases. But in short, the answer is yes. When the system is there, we would like to roll out to other chronic diseases. There are many in the world, like hepatitis, particularly in Hong Kong, or even mental wellness. And that's so we have a plan to do that. But at the first stage, we need to set up and settle the infrastructure first in order to build a more sustainable primary healthcare system for Hong Kong people. Basically, these are two different ordinances. For the tobacco control, the ordinance is actually banning all import of ASP, we say the alternative smoking products, ASP, into Hong Kong. The other is the import and export ordinance. It's talking about exemption, expand the exemption of this ASP in a designated transshipment process. So it actually does not bring the original intent about tobacco control. So we do not believe that even with the import and export in a designated area, basically can affect our effort in controlling tobacco. Having said that, there are very robust systems in place to allow this transshipment. So for those companies who want to do this transshipment, they have to be registered under the customs, all the tracking system, how they do the packaging, and also how they transport these products either by sea or actually by air, should be actually under tight control and monitored by the customs. So that's why we think that they are actually inbuilt system to prevent the leakage of this kind of product to the society, to the community for our people. That is the consultation document, very important one. Citizens can actually scan this 2D barcode, which is also on the screen right now, before 30th of September. And this is a survey, and so the citizens can express their idea about how Hong Kong should control tobacco. In either way, supply, attractiveness, or how to say cessation of smoking, that kind of stuff. At the current moment, we received thousands of feedback already, and we hope to get more basically from the public so that we know the next step, what we should do for the whole Hong Kong, for the benefit for the Hong Kong, and also the future, the younger generation of Hong Kong. And then after collecting all this feedback, basically we will analyze it and to see which is the direction that is more adopted by the public.